Hello, I'm Laura Applegate and I am doing the Module 3 video presentation. In response to the first question, if I could make one change, it would be to hold patients accountable and promote ownership of their health. For example, with the IV drug abuser population, if a patient had come in multiple times in the same year for the same antibiotic treatment for the same condition caused by the drug abuse, there would be limitations as to how many resources would be used without the commitment and ability to demonstrate sobriety. I do not think we are helping that patient or other patients by continuing to treat symptoms without treating the problem, which is addiction. Patients know they can complete their treatment, leave the hospital, participate in the same behaviors that brought them there the first time, and then come back to recomplete treatment. So, no accountability to remain clean is promoted. Our healthcare resources in this country are extremely valuable, and we must be very careful stewards with those resources to ensure that they remain. You would know the change improved the system by looking at readmission rates for the same diagnosis within a certain time period for that patient. You could also examine financial changes. For example, did the cost of IV antibiotic use go down? The legal and ethical implications would be not treating someone if they were not agreeable to sobriety and able to complete an effective rehab. This would raise ethical concerns among people as to if it was fair or not to not treat just because they could not get sober. In terms of the changing nursing role and quality, patient outcomes, and reimbursement, as we move towards a more value-based model of care, healthcare providers will be held accountable for patient outcomes. The entire medical team will have to work together to ensure patients get better and have better outcomes following their treatment, and that they're not readmitted quickly for the same condition. This all in turn affects reimbursement. If providers fail to prove that patients actually had better health outcomes, reimbursement rates could decline. According to Hines and Yu, 2009, in their article, The Changing Reimbursement Landscape, Nurses' Role in Quality and Operational Excellence, found in the Nursing Economics Journal, the funds for Medicare Part A are expected to be non-existent by the end of 2019. Hines and Yu, 2009, go on to explain that CMS will no longer pay for adverse events. This highlights the importance of improved quality of care within hospitals, ensuring safety. To me, this also highlights the importance of adequate staffing. You cannot, for example, prevent a fall without adequate numbers of techs and nurses down each hallway. Also concerning is hospital-acquired conditions. According to Hines and Yu, 2009, The Changing Reimbursement Landscape, Nurses' Role in Quality and Operational Excellence, found in Nursing Economics, if CMS states that these are preventable conditions, then the patient that has this condition will be in a lower reimbursement group. For example, pressure ulcers. These are preventable conditions, and most staff know how to prevent them. Turn the patient at least every 2 hours, provide proper skin care, help with proper nutrition, set up meals, help them eat. However, if you do not have the proper resources in terms of access to lifts, techs, proper nurses, it's difficult for this important schedule to be maintained. Also, vascular catheter-associated infections. When treating a population of a high number of drug abusers, one runs the risk of patients manipulating their lines and causing infections outside of the nurse's control. This is another reason patient accountability in terms of addiction should be highly valued and enforced. I believe in 2020, team nursing will be needed more than ever. According to Fernandez, Johnson, Tran, and Miranda 2012 in Models of Care in Nursing, a Systematic Review in the International Journal of Evidence-Based Care, team nursing helps to reduce IV adverse events and medication errors, and also patients reported better pain control under this model. Fernandez and others went on to explain that quality outcomes were improved. Furthermore, Fernandez and others went on to explain that nurses feel more supported and confident in the care they're providing because you're able to use the education experience of all the nurses on the team. In terms of restructuring activities the organizations will need to be involved in order to be ready for 2020, number one, I believe, is proper staffing. In order to be using effective team nursing and meet the growing demands of patients, there will need to be an adequate number of nurses and technicians. Also, staffing assignments will have to be properly assigned according to acuity. In order to provide proper attention and prevent conditions, nurses must be able to have a fair mix of patients' acuity, allowing them to do so. Therefore, proper use of an acuity tool could enhance the patient experience. Hines and Yu, 2009, in the article, The Changing Reimbursement Landscape, Nurses' Role in Quality and Operational Excellence in Nursing Economics, also discusses what nursing leadership can do to improve the quality of care and in turn impact financial success. I agree with Hines and Yu. One of those is, and I quote, implement a fair and just culture. That was by Hines and Yu, 2009, page 11. Again, in the article, The Changing Reimbursement Landscape, Nurses' Role in Quality and Operational Excellence in Nursing Economics. Many healthcare cultures are punitive, for example, incident reports. These are described as ways to improve processes and not to be used as a form of discipline. However, often nurses are penalized after an incident report is filed. This creates a culture of distrust. A culture of trust would be one where the nurses and techs could speak freely about problems and help those problems be fixed without fear of retaliation. Hines and Yu, 2009, in the article The Changing Reimbursement Landscape, Nurses' Role in Quality and Operational Excellence in Nursing Economics, also discusses streamlining processes. Streamlined, evidence-based practice would help to improve quality of care and eliminate unnecessary waste. In general, healthcare systems will have to prepare for greater shortages of nurses and find innovative ways to recruit and retain the appropriate number of staff. They will also have to prepare for an aging population and the unique needs of the geriatric population. Additionally, they will have to prepare to take care of chronically ill and populations that have more comorbidities. And lastly, they'll have to focus on preventative health more than ever in order to contain their costs. Criteria that could be used to evaluate the effectiveness of nursing care in the organization. Auditing. This would allow the organization to look for preventable conditions that reduce their reimbursement. Also, nurse and tech feedback on sources of improvement strategies. Organizations can also look at their reimbursement levels. Did it increase? Did it decrease? And why? They can also examine patient health outcomes. Did the patient truly get better after they received the treatment? And also that involves looking at their readmission rates. And also looking at patient care surveys where patients give their direct feedback following discharge. I thank you for watching my presentation, and I also want you to note the references used in this presentation are posted below. Thank you.